Hey guys, welcome back to 2823. We're talking week 7. We're going to talk about diagnosis, outcomes, planning, interventions, things like that. So, we're going to build on everything that we talked about this week in class. I'm going to try to get this all in one video. We'll see if we can make that happen. That screen will crop right there. We go. So, outcome identification. If you can swap out the word goal with outcome, I think that makes this a little bit easier to understand. So, what is your goal for your patient? Same thing as outcome. One of the common nursing diagnoses we talked about this week was pain. So, pain related to a broken leg, as evidenced by patient states pain is a 7 out of 10. So, I think that's an easy nursing diagnosis to work with as far as goals go. One of your goals for that patient might be that the patient rates his pain at a 2 or less by the end of shift. You can play with that a little bit, but it definitely needs to have like a number because you had a number in your as evidenced by. So it needs to reflect that it's going to get better. And then you need a timeline. So when are we going to reassess this by? I prefer that you try to keep it within your shift. Some students, depending on the nursing diagnosis, will say by the end of the week. But I think per shift is what we should really be shooting for, depending on the nursing diagnosis. So we want to make sure we have good priorities and establish goals for the outcome criteria. These can be short term or long term. You may have long term goals in there as well, depending on what we're dealing with. If you have pick a little bit harder outcome, such as coping, disturbed body image, that's not something we're going to fix in a day, right? So that would be a little bit more of a long-term goal that we would have. So the purpose is to provide individualized care, promote patient participation, make sure it's realistic and measurable. I already talked about that. It needs to be measurable. So with pain, that's an easy one. You just flip it around and make it a lower number. If we're talking about impaired mobility, it might be, we talked about the guy on crutches. Maybe he can walk so many feet, by the end of the shift with his crutches. It has to be something we can measure. Allow for the involvement of support people, maybe family or physical therapy, things like that. And then there are some activities you can look in your book on box 8.2. It gives you a little more information there. So part of the outcome criteria, I can't remember exactly what page this is on, but it's on the right hand side of your book. I can see it. Your outcome or your goal criteria has to incorporate all of these things. So the patient, we're going to go back to pain. So the patient will report, that's your verb, no pain by the end of the shift. So again, the time, how well is the person to perform the activity? And that's really hard for pain, but that could work in for some other ones. But it really needs to be specific. So if your as evidenced by is patient has a pain of 7 out of 10, your goal needs to be either patient has no pain or reports 0 pain by the end of shift, or maybe reports a pain of a 2 by the end of the shift. These get a little bit more complicated as we come out of that pain realm and into a different nursing diagnosis. Planning. Planning is really important. So we're planning nursing interventions. So once we get a nursing diagnosis written, then we're going to write a goal. Okay, and then nursing interventions is how we're going to reach that goal. This is the 4th phase of the nursing process. I typically tell students I like to see between 4 and 5 interventions. Okay, so if your patient's got pain, can you think of some interventions we would implement for this patient who has pain? How would we help them with their pain? Those are things you're going to want to write down. To help with this, I have 5 words that I give students that they can use that are good for interventions. It doesn't work every time, but this will also help get your brain going. You should always assess something. You should always try to administer something, like a medication if you can. You can delegate things to your CNA. You can educate your patient. And lastly, you can collaborate. So maybe you can collaborate with physical therapy. Maybe you can collaborate with social work, PT. I already said PT, sorry. There's different people that you could collaborate with. So those are good words, just to kind of help get your brain going on what you could do. Again, those are educate, delegate, assess, administer, and collaborate. We'll talk more about those in class, but those help you get those interventions going. Your book talks about a nursing intervention classification system. This isn't something I want you to spend a lot of time on. It's on page 112 of your book. Basically, interventions can be classified. Again, not something you spend a lot of time on. I just want you to be aware. These are how they classify them. If you go back and look at the NANDA list I gave you, I think this is exactly how they broke them down. This is how they decided to separate them, and that's all that means for the classification. So, writing a care plan. How do we write a care plan? Writing a patient plan of care. This care should revolve around the patient. It's not around the physician. It's not around respiratory therapy. It's around the patient, the family, and the nurse. A plan of care is to document the problem-solving process. So you, as the nurse, are the one who comes up with the plan of care. The physicians, they have a diagnosis and they have orders, but as far as the plan of care goes, it's developed by the registered nurse. And you need to document on it as you go. This is required by Medicare and Medicaid standards. Oh, come on, slides. There we go. Evidence of a step-by-step process includes, and this is straight out of your book, so sufficient data to really support the nursing diagnosis. And like we talked about this week, that's really your cues, your clues that you're bringing in. And so if you have a diagnosis of pain, what are your clues to that? Well, did he say he had facial grimacing? Did he, his blood pressure was elevated? That's an indication of pain. Heart rate's elevated, things like that. So those would be your data. That would be your data to support that. Each nursing diagnosis needs one goal. We talked about that a second ago. And your goal should reflect your as evidenced by statement. So as evidenced by saying, hey, this is why the patient has pain, or this is how I know the patient has pain. So flip that around and that's your goal. Outcome criteria need to be identified for each goal. Those were, there was a PowerPoint on that about like the time you had to be measurable, things like that. Nursing interventions are designed to meet each goal. The nursing interventions are examples would be things you can assess, educate, delegate, collaborate, and administer. Each intervention is supported by a scientific rationale. Okay, so you can't just pull an intervention out of thin air. You know, why are we doing this? Why are we going to administer this guy pain medication? Well, hydrocodone has been known to yada, yada, yada. Evaluation must address whether each goal was completely met, partially met, or not met at all. And that's fine if a goal was not met. It happens. There are different care plans. We're going to do concept maps most likely here at EIU. Just know that there are different care plans and what types they are. Instructional patient care plans. This is what would be included in that. Exactly what we've talked about. This is really talked about in box 8.4 in your book. So individual plan of care is written for each patient by a nurse. Standardized plan of care is written by a group of nurses who are experts in a given area. For example, like an OB nurse, like a group of OB nurses or rehab. They identify the most common areas of concern. Geriatric care plan, usually written for a specific nursing diagnosis. Remember, with the geriatric population, a lot of things we can't fix with them, and that's why it's hard to write nursing diagnosis. Computerized plan of care, generated from a computer. A lot of times this happens in the hospital. So when you get out of nursing school, you're going to say, Dr. Gast, I haven't had to write a nursing diagnosis since I've been a nurse. Well, really you have. The computer populates them for you, and then you work off of them. But for right now, in nursing school, writing nursing diagnosis and coming up with a plan of care makes you critically think, and that's the whole purpose. Collaborative care plan, so critical pathways. These are standardized guidelines for patient care in many hospitals. They incorporate their quality indicators and discharge criteria, may ensure the delivery of quality care and reduce occurrence of medical errors. So these are kind of standardized across the board. I'm not sure I can get through the rest of this in less than 5 minutes. Implementation and evaluation. So implementation, we're carrying out what we've written. We've done the hard work, now let's carry it out. And then evaluation, we're going through and determining if we met the goals and what we can do to meet them. I mean, a care plan can be ever changing, so maybe we need to alter some things. So for implementation, we might reassess. We're going to set different priorities, perform nursing interventions, and record what happened. Reassessing really happens every time you talk to the patient. You might write it down, might not write it down, but mentally you're constantly reassessing your patient. Skills needed for implementation. Intellectual skills. We got to be able to problem solve, make decisions, prioritize things. Verbal and nonverbal communication is really important. And technical skills. Are we able to use the equipment? Can we take their blood pressure and supplies to render nursing care? Anytime I see lists like this, I haven't looked at the test recently. I think select all that apply questions. I don't know if that's how you guys think, but when I see that, that's what I think of. Types of interventions. So it can be education, delegation, and supervisory, which we kind of already talked about. Interpersonal, coordinating, supportive, and psychosocial. And technical, maintenance, surveillance, and psychomotor. There are more examples of these in your book. And we can talk about these more in depth as well next week. Coordinate would be like maybe I'm going to collaborate with a certain department. Technical maintenance would be like basic skincare, hygiene, turn to the patient. Surveillance would be monitoring from baseline, anything assessment-wise. Those are some examples there. Purpose of the evaluation, really, did we meet the goals that we had, and to evaluate their responses to the nursing interventions. Maybe we need to change things up a little bit to appraise the extent in which the goals were attained or problems resolved. So really this is just about reassessment. When you evaluate, we need to decide where we need to go from there. Evaluation is ongoing in the nursing process, and we constantly assess responses to medication, therapy, etc. Again, we're always revising the plan of care. Knowledge and skills. So we're evaluating the knowledge of the standards of care. Normal patient responses. Did the pain medication work like it should have? Ability to monitor the effectiveness of nursing interventions. I feel like we're kind of repeating here in that area. And the awareness of clinical research. Structure of the evaluation. Types of evaluation. We got structure, process evaluation, and outcome evaluation. So structure evaluation is like environmental aspects that either like directly or indirectly influence the quality of care. Availability of equipment is one of them. Nurse to patient ratio would be another one. Process evaluation, that's the nurse performance and whether the nursing care was appropriate. So a lot of times they send out surveys about that. And then outcome evaluation focuses on the patient and the patient's function. So compare their outcome to the standard outcome. Outcome evaluation phase activities, reviewing goals, collecting data, measuring goal attainment. There's more examples of this on table 9.2, figures 9.4 and 9.6. The last thing on here is about quality improvement, and I'm going to save that for class because I have 20 seconds before I have to stop. But we will go over this all more in depth in class. I just wanted to get you a baseline knowledge of all of this. Please be prepared to move on in setting a goal and interventions for the case study we worked on this week. Thanks, guys.